We focus on the heart of the GLP-1 community. Real people, real stories, and the fight for affordable access. By listening, you are supporting our advocacy efforts to make these life-changing medications accessible to everyone who needs them. This isn't just a podcast, it's a movement. Welcome to the GLP-1 Collective.
Welcome to the GLP-1 Collective podcast. My name is Amanda Bonello, and this podcast supports a charitable nonprofit dedicated to advocating for affordable access to GLP-1 medications, normalizing their use through community-driven storytelling, and empowering individuals through support groups and educational tools. Visit glp1collective.org for more information. Today, we are joined by Amanda Fratello, a voice that so many in our community will relate to. Her story is one of unimaginable struggle, heartbreak, and persistence in the face of a system that continues to let people down. This conversation is raw, important, and one that deserves to be heard. I hope that it resonates with you as deeply as it did with me. I'm so excited to have you. Thank you so much for joining. I can't wait to hear your story.
Thank you for having me.
There's a lot of power in someone's experience. So let's start with what made you get that first prescription.
I was diagnosed with Hashimoto's disease and hypothyroidism back in 1999. I was 16 years old, and I was experiencing all the symptoms that come with those diseases. I struggled basically all my young adult life with all, the weight loss, the acne issues, major inflammation. It didn't get worse until 2015 when I had a baby. My pregnancy was wonderful, and they say with having hypothyroidism and Hashimoto's disease that is common. Afterwards, though, my systems came raging back, and I started gaining weight massively by doing absolutely nothing. I tried trainers, diets, gyms, you've named it, I've done it. And everything worked at first. First 6 months, I'd be losing weight and everything would be going away and I'd be feeling great. And then it would start trickling back on no matter what I did. 2022 is when I went to my primary and asked about weight loss medication. And I was denied. I was told, no, you don't need it. You need Weight Watchers. You need to join Curves. You need to do this, that, and the other thing. Recommended me to a nutritionist and told me to go see a specialist for bariatric surgery.
You don't need weight loss medication, but you could use bariatric surgery?
Oh, absolutely. I went to the nutritionist. I saw her 6 months, maybe up to a year, and she said surgery wouldn't help. She recommended to stay on a paleo diet or an autoimmune elimination diet. The elimination diet, you basically give up everything. So no red meat, no soy, no sugar, no gluten, no caffeine, no chocolate, no nightshades, which is mushrooms, tomatoes, all of that. You're supposed to completely remove that from your diet and then slowly incorporate them back in. And it may work, it may not. I was like living off of chicken and rice and vegetables. Like that was it.
What's living at that point?
I did it for 6 weeks. It wasn't working. So they didn't know what to do. In 2023, I started fertility treatment. Me and my husband were trying to have a child and it wasn't going anywhere. So we went to a fertility doctor and she recommended a GLP-1, like right out the gate. She's like, everything looks great except your thyroid levels. Why don't we try a GLP-1? And I said, oh, I've been asking for these things and nobody would help me. So she sent me back to my primary and to my endocrinologist. They both declined again to prescribe me a GLP-1, even though another doctor was recommending it. I found a weight loss specialist. She said, yep, let's start you on Wegovy. You absolutely need this. We've seen really good results for people with Hashimoto's disease and hypothyroidism. And then my insurance declined me multiple times after multiple prior authorizations. This doctor was jumping through hoops and they kept denying over and over and over again. Finally, last year, June of 2024, I finally was approved for a GLP-1 medication and I have been on one ever since.
Wow, that took a long time. Wow, that's an amazing story. So you've had the whole ring around from doctor to doctor, insurance to
Yes.
prior authorization to prior authorization, and
Yes.
you did finally get approved.
Yep. And then guess what happened?
Oh no, I'm scared too.
We got a letter sent home in November. They are no longer offering weight loss medications through my insurance. So I have 6 more shots, and next month I will no longer be able to be on a GLP-1 medication.
Yeah, I know a lot of people lost access that had insurance coverage, and a lot of them did have stories like yours. But to be honest, I think yours is the most ring around the rosy that I've heard so far. It took 6 months to get approved.
I got approved in May of 2024, and then it took me a month to get a medication because there was none available, back order, and all, all that fun stuff. So I started late June of 2024.
And then November, you got the notice that they weren't going to be prescribing it anymore.
Yep, I'd have to pay out of pocket for it no matter what. It was actually not my health insurance, but my prescription insurance through my work and our health trust, who came back to us when we all went to them and said, "Why are you doing this to us?" And they said, "Well, you're causing our health insurance system to go bankrupt to have this medication. That there's so many of you that are on this medication, it's costing us millions of dollars. 1% of us are on medication, and we're causing the entire system to collapse," which I think is just a load of,
Sounds
yeah.
like an excuse.
You want to know what our health trust recommended?
What?
Bariatric surgery, Weight Watchers, and just good old fashioned willpower.
It's
It is.
shocking that that is still a recommendation from healthcare professionals. With all of
Yes.
the science and now with the new definition for obesity.
My entire life, it's always been my fault. It's been my fault that I cannot get the weight off. I've been called a closet eater. I have been called like I've been diagnosed with eating disorders and I don't have them. And then they would send me to a nutritionist who would then say, "Well, we're not really seeing this, so we don't know what to tell you." And so it's either been it's your fault or we don't know what to tell you. And then when you do finally get a solution, something that, I mean, I cannot tell you what this medication has done. And I was a skeptic myself. I thought, well, I've tried everything else. Nothing, this isn't going to work. And this has been, this past, it's not even been a year. I haven't even got to have it for a year, has been life changing for not just weight. I've only lost 40 pounds, which I mean is a lot for me. It's not a lot for some, but that has been life changing. And the amount of inflammation that has been my inflammation's gone. It's gone. I mean, I used to have pain, like it hurt to be hugged. My inflammation was so bad. My skin hurt. It was always red, inflamed. I had cystic acne all over my face, all over my upper body, and it's gone, completely gone. And, like I had skin issues, hair issues, and like my eyebrows were gone. My eyebrows grew back.
Oh, wow.
All of this stuff, all of these things that I just thought was age or my disease or whatever, but it wasn't my fault. And that's been something, like I had a huge breakdown when I went to see one of my nutritionists that I was prescribed when I went on this medication. So besides my thyroid levels, I am healthy. I don't have any other issues. They can't figure out how to treat this except by putting me on a GLP-1. And now I can't have it. And I still can't afford compound because I need trizepatide, and trizepatide is expensive.
Well, it's not just expensive, it has been taken off of the shortage list. Pretty soon, compound tirzepatide will very likely not be available at all.
Right.
And I know a lot of compound pharmacies are trying to hang in there and use special formulations so that they can get by it. But
Yes.
in mass, it's not realistic. It's going to end up getting shut down. So a lot of us are losing access altogether. And I'm right there with you. I cannot afford the name brand out of pocket, even for their lower prices. What dose are you on, if you don't mind me asking?
I'm currently on Zepbound 10 milligrams. I tried semaglutide at first and I was having a severe reaction to it. So they switched me and said, try trizepatide. The people that are having symptoms seem to not have symptoms when they go on this. And I've had no symptoms no side effects at all from this. It's been wonderful.
I also had no symptoms with
Yeah.
tirzepatide, but I have heard that there are some people who don't respond very well to sema. So it
Yeah.
doesn't completely surprise me that that didn't work super well for you. So you now you have no pain, or do you still have some pain with Hashimoto's?
No pain. No
Wow,
pain,
that's
no
amazing.
joint pain, no inflammation. Like I said, I used to have like back pain, knee pain, ankle pain, foot pain, hand pain, and it was always coughed up to, well, you work a desk job. So maybe it's because you sit. Maybe it's because you're using your hands all the time. It was just always, there was always an easy excuse for everything. And nope, I have absolutely no pain at all. I sleep great. My digestion's great. I mean, like I said, I finally feel like, oh, this is how you were supposed to feel all along. I just thought everyone had these issues. Or again, it was, well, it's your fault because you're not doing this and you're not doing that and you're not working out 2 hours a day and you're not eating these foods, all these things. And none of that was true. None of it.
Yeah. I mean, I love that you said you're not working out 2 hours a day because I've I've definitely known some very, very naturally thin people who do not have insulin resistance or PCOS or any other diseases. And
No,
they can eat lots of pizza and not work out at all
no.
and stay super, super thin.
But like I said, it's my entire life. It's been, well, you're not doing enough. You're not enough. You're not trying hard enough. Being 17 years old and having a doctor tell my mother she's a closet eater. I guarantee that's what she's doing because there's no way she would have, this kind of weight gain. Like literally,
He
I
said that
could,
in front of you?
yeah,
Oh my
yeah.
gosh.
Yeah. Or that I was a binge eater, or that I'm just lazy. I'm not trying hard enough. I'm not working out hard enough. I'm not, doing all even my personal trainer was
Oh my gosh. You had a
shocked.
personal trainer.
Yep, I got a personal trainer. I had one for almost a year, and he was even surprised at no matter what I was doing, like I'd start gaining weight. I'd be training and gaining weight. And he'd be like, oh, well, it's okay. It happens at first. It'll come off later. And it never did. And it was because of the inflammation. I truly believe for me, that is my problem is that I suffer from extreme chronic inflammation due to Hashimoto's disease.
Yeah.
And there's not much they can do about that. This was the first time. And I've heard that they are doing research for GLP-1s for Hashimoto's disease for treating inflammation. So, I mean, fingers crossed that if they ever approve that I can get back on insurance and get back my medication. But as of right now, because we're using it for weight loss,
Mhm.
I can't have it. I'm not allowed to have it. I need to try Weight Watchers. And I'm already
Um,
gluten free. Like I'm already on a diet that I put myself on many years ago. I'm gluten free. I am sugar free. I try to do I do all the things that they tell you to do.
Weight Watchers even started selling compound versions of these medications
Yep.
because people who were doing Weight Watchers were not keeping the weight off.
The amount of dietitians and nutritionists and that I've seen in my life, they would not recommend any of those eating programs. They would never. They always recommended the apps to count, and my last nutritionist was like, I would agree that you have an eating disorder at this point because of everything you've had to go through. You're constantly worrying about food and who's watching you eat, what you're eating. Are people judging me? Like that's my food noise. My food noise is what I think everyone else is thinking about me. Couldn't be first in a line at a buffet. No way. I had to wait until everyone else got food before it was acceptable for me to go up and get something to eat. And I wasn't even an overeater.
There's a lot of people who have the experience of family and friends constantly making comments while you're eating. Not necessarily directed at you, but it's like a constant, just, I'm gonna have to work out after this meal. I probably gained 10 pounds, or I wonder how much sugar is in this, or how many calories. And it really kind of sucks the enjoyment out of that family experience.
Oh
I
yeah.
don't know if, have you had that experience?
Very similar. I'm from a very strong Italian family, so there's always food. It was always pushed that you had to eat and clean your plate. And,
Yeah.
and we were all obese. My sister had bariatric surgery and is on a GLP-1 now because of her eating. And, she has found success as well. We always had to clean our plate, but then if we did, you still got your finger pointed at for eating too much. I don't think that's where it started. I think it's just the upbringing. I was an athlete, I was in theater, I did all these things. I always felt like everyone was staring at you. Are other people watching what I'm doing and judging me?
Yeah, I 100% get that. There's anxiety that comes with the food noise. It's kind of
Yes.
like akin to a boogeyman. And I'm not sure if you feel this way, but for me personally, on a GLP-1, I'm always afraid of that boogeyman coming back. And
Yes.
now that I know that he's there, I'm just like waiting for
Yes.
it to rear its head.
But and yeah, mine's waiting for me next month when I run out of meds. Like I've been emotional about this ever since I got that letter. Like, wait a minute. I finally, after everything, after all these years, after all this, and now you're telling me you still can't have this. And I'm sitting there going like, people get that joy of changing their wardrobe on their GLP-1. You see all the videos of everybody going out and getting new clothes. And now I'm sitting there going like, well, I'm not going to get rid of my clothes. Not even going to bother enjoying where I'm at right now because it's all going to come back. And I'm going to lose it all again.
So, just to be clear, so that the people who are listening understand, when you stop taking this medication, and you have to stop, you're saying because you can't afford the brand name to pay out of pocket.
No, I can't afford that or compound. Even if compound was available, I'm a paycheck to paycheck household. There's just no, I don't have it. I wish I did.
Well, don't we all?
I know.
When you stop taking this medication, what do you believe will happen?
I'm going to gain my weight back. Maybe not quickly, but um, I had a miscarriage a few weeks ago actually, and I had to be off my medication for 2 weeks, and I had already gained back 15 pounds in 2 weeks,
I'm so sorry.
and no change to what I was doing for myself. No change in food, no change in exercise regime, nothing changed. And I had gained that weight back. And within the first week of taking my shot again, I lost that 15 pounds in a week. So again, for me, it's not just a weight issue, it's not just fat, it is inflammation. When I stop taking this medication, I inflame that quickly. I just blow right up. And I started breaking out again. Like it just happened overnight. So I know that's what's going to happen. When people have to stop taking this medication, even if they stay doing the same things that they were taught to do, even if they did their lifestyle changes, you are going to gain back your weight. At least 30% of it is what they're saying.
Obesity is a chronic disease of inflammation. And you're absolutely right. Some people might have success. We don't know. Long term is what I'm wondering, because I know there are some people who have short term success in keeping the weight off, but that's like within 6 months. And that
Mhm.
doesn't really tell us anything because
Right.
6 months isn't much of a
That's not enough.
predictor.
Yeah, that's not enough. My sister, she got on the GLP-1s early on, like back in like 2021 when they started becoming just like a normal everyday recommended thing. She got on one because it was recommended because the bariatric surgery didn't work. She started gaining the weight back. And she was on one for a year, and then they told her, okay, now you have to come off of it because that's what they were doing then. You had to go on it and come off. She gained all the weight back and had to go right back on one. So now, I mean, they're saying that you should stay on one because just like if you had heart disease and you were on a heart medication, you don't just stop taking it because your heart's doing better. No, You stay on the medication because that's what's keeping your heart going. And that is what these GLP-1s need to be for us. We need to stay on them because we have a disease that is not going to go away. And no matter how many treadmills we buy or how many smoothies we make, it's not enough for us. And I'm tired of the stigma. I am tired of hearing it is your fault, my fault, our fault that we are just not doing enough.
Yeah, 100%. And that is a large part of why we're here doing this interview right now,
Yeah.
because we need to bring compassion and empathy into the conversation. And we need to make people understand that these are human beings who need their medication. This is not about hot girl summer, losing 5 pounds for the summer so that you can go to the beach with your beach body. This is about people who are living with pain and
Yeah.
suffering for, like you said, since you were 17. Is that right? When you
Yeah.
were diagnosed with
Well,
Hashimoto's?
I was diagnosed at 17. I've had a weight issue since I was probably 9 or 10. They think that is when my disease probably hit, but nobody paid attention to it. I was just a little girl getting fat or a little girl going through puberty. They never tested anything. They never tried anything. They never looked into it. It was just, well, she needs to eat less sweets and you need to make sure she's out playing outside more. So, I mean, yeah, you could go back to 17, but it's been my whole life.
Interesting that you say that because I just met with a woman whose her daughter is using semaglutide. She's 12 years old. And I thought that it was very interesting that she said when she'd started asking for advice, when she was first researching, she went on Reddit and she was like, can anyone tell me if their child is using this medication? Because I see a lot of what I dealt with at her age and as an adult, and I don't want her to go through the same life of suffering. And so many people jumped down her throat and they said, no, your
Of
kid
course.
needs to eat less and move more.
Yeah. Yeah.
Unbelievable. And these were people who had been taking GLP-1s, raving about how much it had changed their lives. And they were all saying, no, no, your daughter needs to eat less and move more.
It's
It's shocking.
it's shocking. It's so frustrating. Like I'm at a loss of words. I feel like we hit a point where I start seeing people being better about things about, like the weight thing. And then it's like, nope, nope, we're not going to do that. Especially this, like you find a solution and you get more issues from people, like more. I can't tell you how many people at my work complain that I'm on this medication.
Oh, okay. I want to hear about
Yeah.
that. I was
Oh
going to
my
ask
God.
you about people in your life and if you dealt with any stigma. So I want to hear about this.
I would say it's been my coworkers and a couple, I would call them friends, but have made comments and they're like, so you just don't eat now. No, I do
Mm.
eat. Yeah, I do eat, just more controlled about it. And, I get fuller faster, so I don't have to finish everything, and these people really don't have a place to have an opinion, but they do. And I have a few friends recently that have also gotten on GLP-1s and they are doing great. And they've come to me for support and questions because I've been on it longer. I've had people say to me, oh, well, see, they're losing weight too because they're cheating. It's not a cheat.
Really?
I said, you do realize I'm on one. Why are you saying it's a cheat? Well, because they couldn't do it before. And I said, and why? Why? Do you know why? Did you even bother to ask what they've gone through? One of them's a diabetic. You think that they don't deserve to try to get healthy? This is not a cheat, not at all. And I said, and you don't have a right to say anything. So don't. But my coworkers, they're always like, well, you don't eat anything now. And because I don't participate in cake and I don't participate in all the donuts that come in every morning, but I'm also gluten free and I have been for 3 years. So why is it a problem now? Why do you have an
Hmm.
opinion now? Well, those things have side effects. Yeah. Don't you go out on a cigarette break? You don't have this medication, so you don't know. And I said, I'm not having side effects. And if anything, I feel great.
Ugh, I I can't believe that someone actually said cheating to your face.
I know it's
That
cheating.
blows my mind. You hear that on social
Yeah.
media, but I can't
Oh
believe
my
people are
God.
out there saying it to people's faces.
Yeah. Oh, you're cheating. You know, it's like, No, it's not a cheat. It's not
I
a
like
cheat
to
at all.
give this I like to give this example. I have asthma. That is a
Hmm.
chronic disease. If I stop using my asthma medication, I can't breathe. Is it cheating if I don't want to die?
Yeah, apparently, I mean,
It's a medication.
they call it a weight loss medication too, but if you talk to any of these doctors, it's not a weight loss medication. That is just something that happens when we take this medication. It's a
A
bonus.
side effect.
Yeah, it's a side effect. It's a bonus, but it's not what, like, yes, it helps us to do that, but it's not a medication to make you lose weight.
And that's what drives me crazy. I'm trying so hard to change this conversation. I know there are a
Yes.
lot of advocates out there doing that because this is not a weight loss medication. It's a medication that treats a chronic and vicious disease that is associated with several of the leading causes of death in the United States, and it needs to be taken seriously. And when you say weight loss medication, or I'm on LinkedIn a lot, there's a lot of doctors on there and pharmacists, and I like to see what they're talking about. And they will say um, something about people getting their shot subscriptions so that they can have a quick fix. And I'm
Yes.
like, oh, you're in the industry. You should know better than that. That is shameful language right there, dripping with stigma.
Yes. And then I've heard people complaining that, with everything going on with our medications being back ordered and lost, they're blaming it on like celebrities and blaming it on all these people that are on it for quick fixes. And I'm like, do you know how hard it is to get on this medication? When they were like telling me that, oh, well, you just got on this medication. Do you know how long it took me to get on this medication? Do you know what I had to go through to get on this medication? It's not something that you just go pick up at CVS. It's a prescription. And my doctor had to tell me all these things that you have to meet in order to have this medication available. And I'm like, it's a medication. It's not something that is just easily accessible for everyone. And I said, and if anybody can get it that quickly, God bless them, because I have yet to hear that. Like I said, it took me years. I have two really good friends right now that were just prescribed it. One is a diabetic. One has a weight issue, so she was put on for inflammation. She also suffers from PCOS. So both of them too. It took them probably a year and a half before they could get approval for the medication as well.
Even with the diagnosis of diabetes,
He is type 2. So they put him on a different medication that ended up hospitalizing him. And then he
was it
finally,
metformin? I don't mean to interrupt. I'm sorry.
no, you're fine. Trulicity.
Okay.
Trulicity put him in the hospital with severe dehydration. He couldn't handle it. So then he had to wait and he just got approved for it. I think last month he has been put on Ozempic. He's been put on Ozempic for the diabetes, finally. And they're both doing great with it. They come to me for protein tips and, what do I do for this, that, and the other thing. And so, it's been good. And I'm glad that their insurance is covering it.
It's so incredibly important to have a support system with people who are actually using this medication. I've seen a lot of people reach out recently talking about how it's helped with their arthritis, it's helped with Hashimoto's and other inflammation related diseases. I mean, even I can't understand what that's like, right? It's so hard in a world where people are telling you to your face that you're cheating to
Yeah.
try to get by alone. It's just impossible.
If they haven't walked in your shoes, they don't know. They have no idea. And even people that are walking in our shoes, I'm tired of people with having these negative opinions just because you're seeing success. Because that's what I think it comes down to. You're seeing success and you're not allowed to.
When I first started looking into it, the first thing I'd heard was that it would kill you, that it's bad, it's terrible medicine, you don't know what you're putting in your body.
Right.
And I was like, oh, well, that sounds awful. I don't know why people are using this. And I was against it myself at first. So I understand how some people they hear these things and they think that that's the only reality, that whoever they heard it from must be the only person that's right. But it wasn't until I realized that so many people were using it successfully. And honestly, that I was jealous. I was talking to my dad And he was like, your cousins are on it, right? And I was like, no, I did not. Why are they taking it? Are they diabetic? And he's like, no, they're sick of being fat and miserable. And I was just like, oh my God, that hurt. That hurt me so bad in my core. That hurt me
Yeah.
so bad in my core. And it took me that moment of like taking the breath out of me to think, I'm also sick of that. What is wrong with me? I need to do more research. And I'm hoping that people listening to this podcast, they are also sick of it. And they've only heard bad things and they are curious about the other side. So thank you for sharing your story.
Yeah, I mean, I wish I wish it was different. I wish I had a happier ending. I'm hoping that this isn't my ending on a GLP-1. I hope that something happens.
We
Hmm.
are looking into a way that we might be able to help people pay for their medications, lawmakers and health insurance and PBMs and big pharma, and to get them all on the same page, bring this price of medication down, give us a generic sooner, let us keep using compound, give us insurance coverage for a chronic disease that is killing people. That's not going to happen overnight. So we're working on a shorter term solution, something that we can do right away. Because I know a lot of people are very scared right now. And every one of the board members also cannot afford the name brand medication. So
Right.
we're not just working on it for ourselves, we're working on it for every single person out there, the thousands of people out there who are about to completely lose access. Because if you don't have affordable access, you don't have access at all. Just stay
Mm.
strong.
Thank you
We're going to
guys
do
for
what we can.
everything. Yeah, thank you guys for everything that you're doing. I've been following you and following everything that's been going on. Something needs to change. Yeah, it shouldn't be this hard. It shouldn't.
It's not going to change overnight. So we're just going to do everything we can
Mhm.
to make history, make life better for everyone so that
Right.
people like you who have had these incredible life-changing experiences don't have to go back to a life of misery. I don't know if it's rude to ask, at what price do you think you could afford this medication monthly?
Realistically, we were trying to find something under $200 a month. And
That's reasonable.
I haven't been able to find anything under $400 a month. Paycheck, paycheck, two kids, mortgage. We have okay jobs. We have good jobs. It's just $400 a month, $500 a month. That's a mortgage. That's a car payment. I don't have it. I've tried all those online places. I did all the interviews with doctors and PAs and everything, and I could not find anything under $400. And that's not including subscriptions to their sites and consults, and you had to pay for all those things. Like, couldn't find anything. I even considered trying to find something where I dropped down the dosage just so that I didn't lose the meds. And I couldn't find anything still under $400.
There is a third-party website
Hmm.
that we're not affiliated with. I have to say that for legal reasons, but it's called glp1winner.com. They have breakouts of all of the pricing, ratings, whether these companies are certified, if they're registered, for the ability to make a comprehensive decision so that you can actually compare all of these different providers. So I would suggest um, looking there, but I can't give actual suggestions for where you should go
Hmm.
legally.
No,
People have reached out, and I'm like, I'm sorry, I legally cannot do that, but I would look here for a comprehensive view.
I actually saw your TikTok for that one, and I was glancing at that site yesterday.
Hopefully, you find something that can help you there, because I 100% understand 400 is too much for me too. I just can't do it. I've got three kids on Medicaid. We also live paycheck to paycheck. It's not realistic. I wanted to touch on the bariatric surgery. So your sister had bariatric surgery and she did end up using a GLP-1 later because she'd gained the weight back or some of the weight back,
Yes.
correct? It's really interesting that you bring that up because I have not met but one person who has had bariatric surgery. And it might be because I'm in the GLP-1 space so hard. So maybe that's why. But I haven't met anyone except for one person who has had bariatric surgery and did not gain the weight back and or use the a GLP-1 later because they gained the weight back. And I actually know more than one person who has had more than one bariatric surgery. I didn't even know that was possible, but they go back in and they like, I don't know,
Didn't know
do
you were
something to your
allowed.
stomach. I
Yeah.
know.
I thought
There's
they were like, this was your one shot deal. I didn't know that you could go back. Yeah.
Yeah, that blew my mind. And then the one person that I do know that has not gained their weight back. They said they were looking at getting on a GLP-1 because they like struggle every day. They said that it's a daily struggle. It's been really hard.
It's hard because, like we said, obesity is a disease. And just like any other disease, surgery doesn't always fix everything. And for my sister, she also has thyroid conditions as well. So I have a feeling that bariatric surgery probably wasn't an answer, but at that time, that's what she was given. She had a sleeve done in like 2015, and then I didn't even know she was on a GLP-1 until I was telling her that my fertility doctor recommended it. And she goes, "Oh, I'm on one of those." I'm like, why didn't you tell anybody?" And she goes, "I didn't want to hear about that I shouldn't be doing it." So, like we said, the stigma. She's been hiding it for years that she was on a medication to keep the weight off. She goes, "Well, I started gaining the weight back, and my doctor said that I needed to get one of those. But I guess now they kicked her off because she's not a diabetic. And then they wouldn't give her a medication. So she is getting compound so that she can continue to stay on a GLP-1 at this point."
So
Yeah.
she's in the same boat, essentially, once compound is officially gone.
Yes. She doesn't believe that's going to happen, but
A lot of
you know,
people don't, and it's honestly it's distressing for me because we need as many people as possible to rally together to prove that the public cares about this. And there are so many people that I'm meeting that are like, oh, compound pharmacies will find a way. They'll sue again. My doctor says it'll be fine. Or I don't want to think about it until I have to.
yeah,
On the chance that it does happen, it's
yeah,
better to try to do something before that happens, which is
yes,
why we jumped on all of the opportunities we could immediately and started trying to grow now because when the time comes, there will be a lot of shocked and distressed people.
yes,
And we need to be there so that we can all rally together in
yes,
Washington, D.C., baby. It's really sad about gastric bypass surgery because it's so expensive and physically you go through so much and
yeah,
it's like a waste when you could just be using this medication. But, a lot of insurance companies, they will cover gastric bypass surgery and it's very expensive.
yeah.
So it doesn't make any sense.
That is why we, through my work, were so angry when they were like, well, you can do Weight Watchers or you could go and consider bariatric surgery. We're like, I'm sorry, what? You want us to go through surgery, lose time at work, and that's covered under insurance, but my medication's not.
It's not a good system. There definitely needs to be changed. And this is another thing. There are so many people using this medication without telling anyone in their lives because of the stigma. But
Yeah,
because of that, there's not a real accurate guesstimation of how many people are going to be affected when affordable access is taken away. And when I say that, I mean, oh my gosh, the amount of people who have been coming out of the woodwork since all of this has started with the petition and the nonprofit saying, oh, I'm actually on that. Oh, I'm actually on that. Oh, don't tell anyone, but I'm actually on that. Or my favorite story was an old coworker who I ran into, and they were like, I don't know what that is. What is that? Because I told them we'd started up the nonprofit. I don't know what that
hmm
is. And then they were like, okay, I'm on it. I'm on it. Okay, I'm on it. My whole family is on it. We're not telling anyone. We're all on it. We don't know what's going to happen when it's taken away. And I'm like,
Right.
oh my gosh, it shocked me so much.
Yeah.
But it's true. There are so many people. And first of all, those people need a support network. Those
Mhm.
poor people need support. And second of all, we need to smash this stigma and get the healthcare that these people need. Your story is incredible. You're incredible. You've been so great to talk with. I've really enjoyed it. So you said that you've got a little bit of a stockpile to hang on to until.
I have 6 more doses left. Yep. I'm
Yeah,
cherishing every moment.
yeah. I know there was a woman that I spoke with who is in maintenance and she has arthritis. And she said that she was doing so great. And then her and her doctor were trying to figure out a good place for her to stay where she didn't suffer from, food noise. And she tried to stretch it out for 2 weeks. Every time that she surpassed that week, her arthritis would start to come back. The pain would start to come back. So they were trying to figure out how long she could go before she started being in, like, feeling pain again. She couldn't stretch it out more than, I think it was 10 days was the maximum amount that she could stretch it out. And even then, she was starting to feel the pain come back because the inflammation would come back.
Yeah. When I had that my miscarriage, I had missed that shot and I missed the following week. So I mean it was a very early I I, I was maybe only 5 or 6 weeks. So I'm okay. But we I missed that shot because I took a test and found out I was pregnant. So I didn't take my shot that night and I didn't take the following week shot. And then by the end of that week, we knew we had lost it. And, my doctor said, get back on your shot and everything like that. So within those 2 weeks, I didn't have my joint pain and my skin pain back or anything like that. But there was a definite digestion issue starting and my face broke out, like all around my jawline. I thought it
Yeah.
was something I was doing. And now I know it's something to do with my inflammation that causes me to have this inflamed cystic acne that is hurts. Like overnight, within a few days, I started having breakouts. And my mom's like, wow, she goes that quick without that shot. And look what happened. And I even notice on my week to week, like I take my shots on Wednesday night. By Tuesday, I'm already ready. Like I am already starting to feel some things going on. And I automatically feel better overnight after I take my shot. Like the next day, I finally feel like myself again.
It's crazy how fast it works. This woman that I had
Yes.
just met with was talking about how it took her like 20 minutes. And I was like, me too. Like day one, I noticed the food noise going away and I was like, what is this? It's insane how quickly it works.
My friend with the polycystic who just started using the med maybe a month or two ago, she was just on her beginning dosage. She's messaging me and she goes, I'm already not hungry. I'm like, huh, well, that's quick. And I said, make sure you're eating though. You got to make sure. I said, go eat some chickpeas, go eat some protein, something. She's like, yeah, but I'm already like not even feeling it. And I'm cooking dinner right now. And I said, no, I said, I've never heard of that. It took me like a month, but good for you. Keep it going, but just make sure you're eating. That's all I keep telling everybody. It's not funny to joke about it. Make sure you're eating.
And what blows my mind is a lot of people don't use the medication and they say, oh, you're only losing weight because it makes you so sick you can't eat. If you're so sick that you can't eat, then you've got some side effects that you need to talk to your doctor about,
Right.
and they need to help you manage those side effects or get you on another medication. You are not supposed to be so sick that you can't eat.
Yes, and how I don't know how many little TikToks I see of people joking how, oh, I haven't eaten all day. That's not a joke. Please don't tell people this is funny or okay to do. And this is why we're getting all of this negative and people coming at us. Well, you're just honest because you don't want to eat. No, that's not why I'm on this. I was on this because my fertility doctor thought it would help me get pregnant. Because I'm not constantly thinking about eating and when I'm going to eat and who's going to be there and who's going to be watching and all these wonderful things. I'm focusing more on, okay, well, I'm not starving to death anymore. So I can actually consciously think about a positive way of eating and eating better because I know I'm not going to be consuming all day anymore. So I can just, focus more on eating the right way.
Yeah, absolutely. I never liked celery before. I always thought it was disgusting. But lately I crave celery. I'm not sure if it's because of the water and fiber mixture, like my body just needs it, but I'm eating them by the stalk. I'm just like walking around the house with a whole stalk of
Like a
celery.
rabbit.
I don't want chocolate now. I
Right.
want some celery. If I don't eat, I will lose my hair, and I don't want to lose any hair.
I've heard people talking about that too. Like, oh, I don't know why my hair's falling because you haven't been eating. Like,
Yeah,
just eat something.
get
It's
some
that easy.
protein. If there was a message that you could give policymakers, healthcare insurance, doctors who don't understand, people who think that it's cheating, about the fact that you're going to be losing access to your medication soon. If there was a message that you could give those people to make them understand how important it is that you don't lose access, what would that message be?
GLP-1s are giving people life, not taking it away. It's giving us our lives back.
That's a good message. 100% true. It's so simple. It's 100% true. I'm just grateful you're out there trying to set the record straight for people like your coworkers and stuff. A lot of people just kind of clam up and
Oh yeah,
they don't do well with conflict.
I have no problem telling anybody. A lot of my friends, I mean, they know what I've gone through. They know how many things I've tried, how much I have struggled in my life with my disease and my weight. As soon as I got this medication, I was telling everybody, yep, I'm taking this medication and it's going to do something because something's got to do something. And I had no problem telling anybody when people are like, oh, you look great. What are you doing? I'm on a GLP-1. And I have no problem telling everybody what I've been going through right now with having it cut off
Yeah.
and how disgusting that is, what our healthcare system is right now. Nobody should not have access to any medication that they need, period.
Not if their doctor is prescribing it, saying that their patient needs it.
Right? Yeah, I have several doctors that want me on this medication. Doesn't matter.
Thank you so much, Amanda. And I'm so
Thank you.
sorry about what you're going through. Hopefully, we'll be able to figure something out fast because I know a lot of people are going to be losing access soon. We'll do what we can. We'll do the best we can.
Fingers crossed. Yep.
I'll see you next time. Definitely come back.
Will do.
Bye, Amanda.
Bye bye.